Well, welcome to today's update. Let's try and make a bit of sense of what's going on in the United Kingdom at the moment, because I'm not sure the rest of the world does. We've had this group of 122 scientists sending a letter into the Lancet saying this reopening is a big mistake, this dropping of legal restrictions. We've got the government, the chief scientific officer, the chief medical officer, and most of the scientific advisory group for emergencies, SAGE group, saying this is the right thing to do at this point in time. So what is going to be the consequences of this? Well, of course, it's always difficult to look into the future. But as ever, Neil Ferguson, who I know a lot of you don't like, but nevertheless, he is a SAGE member. And he is saying it's going to be a difficult summer. Well, I don't think actually you need to be a SAGE member to realise that. It is. Let me just give you an example. All over the country last night, people started queuing outside nightclubs, and they were let in all of a sudden at the stroke of 1 second past midnight. So for Monday, immediately we've seen videos of large numbers of people flooding into nightclubs, no masks, no social distancing, and everything you would expect of a normal nightclub. This is guaranteed. These are basically guaranteed super spreading events. The number of cases is going to go up massively. Now, the number of cases, the average, it wasn't that many. It was less today, but it's been about 47,000 average over the past few days. And this sort of thing is going to double that in no time at all. Now, just to dispel a slight rumour, someone has said that they saw me in a nightclub last night. And I want to guarantee that wasn't the case. I was actually asleep in my caravan. I've got nothing against nightclubs. I went to one myself in 1982. In fact, I went to one again in 1983. So nothing against nightclubs, but it wasn't me last night. But seriously, this sort of, it really is. I mean, only a third of young people haven't had one single dose of vaccine yet. So it's going to be a difficult summer. England and Scotland have eased restrictions. Scotland's actually what you call level 0. It's not quite as liberated as the UK. It's still legal, still a legal requirement to wear face masks in Scotland. Almost all legal restrictions on social contacting end in England, so you don't have to wear a face mask. It's no longer a legal requirement. Now, having said that, this was the delayed reopening on the 19th that the government wanted to bring about a month or so ago, but of course it was delayed because of the Delta variant. So they've more or less had to do this, but they've been saying, but we expect people to wear masks in public places. We expect people to wear masks on public transport. The Mayor of London, for example, has mandated the wearing of masks on Transport for London. So I went to my local supermarket today. I had to pick up some medicines. And basically, I did a non-scientific survey in the supermarket of these excellent ladies in the pharmacy section of the supermarket. Maybe we can go in a little bit. You know, yeah, sorry about having me in there, but you know, supermarket workers really are the unsung heroes of this pandemic. You know, that they've worked all the way through both waves, and you know, without that we wouldn't be able to eat. You know, it's just, I really think they deserve some respect. And I saw a lot of people today, not always, but often younger people, not wearing masks. And I think it's disrespectful to these supermarket workers who've actually given us so much lately. And of course, the supermarket workers themselves here are wearing masks, so that these ladies work in the pharmacy. Now, I did ask them about mask wearing. They said most people are wearing masks, but the ones that aren't tend to be younger people. So we're going to get super spreading events in younger people. Many younger people are wearing masks. Of course, we can't overgeneralise, but that was the sort of impression today. So I just wanted to put these two ladies on to represent all the supermarket workers and all the pharmacy workers and all these essential retail outlet workers in the country, really, who've done have been unsung heroes in this pandemic. So thank you all for that. So legal restrictions, so still advisories, but not legal restrictions, right. Neil Ferguson says, cases almost certain to reach 100,000 per day. Well, that is going to happen really soon. that's inevitable. Now, hospitalisations, probably on about 500-600 a day at the moment, is expecting those to go up to 1,000 admissions per day, is what he's expecting. And he thinks if we can maintain 100,000 new cases a day with 1,000 hospitalisations a day, this represents success. So this is kind of, this would be good given what we have. And of course, the virus would be spreading around dramatically. Lots of people would be being exposed. People who've had 2 vaccines and don't get sick, when they're re-exposed, are going to get an immune boost. People are going to get an immune boost from the first time if they're exposed to it. As a lot of them are people that are vulnerable to the virus are younger, then most of them won't get sick. But we are going to get these kind of numbers, 1,000 a day hospitalisations. This is significant. Now, Neil Ferguson also said, it's not really Neil Ferguson. He plugs these numbers into really complicated, sophisticated disease modelling things that ordinary people like me can't understand. But anyway, he said it's possible to reach 200,000 cases per day. And the way we were going yesterday, I wouldn't be surprised if this happens, I'm afraid, at all. And it's possible to reach 2,000 hospital admissions a day. This will cause major disruption to the NHS. We do not want 2,000 admissions per day. But he said these larger numbers are much less certain to predict. In other words, Scientific Advisory Group for Emergencies is saying they don't know how this is going to pan out. May need to slow the spread to some extent. In other words, this means that some restrictions may need to be reintroduced. If hospital admissions were to reach 2,000 to 3,000 per day, or indeed if they were predicted to reach that, then the government might have to reintroduce some restrictions. So they want this to be irreversible. Of course, everyone does. But the key parameter is going to be the 2,000 to 3,000 hospitalisations per day, which could necessitate some restrictions being reintroduced. And apart from that, we've got the immense backlog of patients with cancer and varicose veins and hip and knee operations and all these elective surgeries that are so important for the quality of life that aren't being done. There's such a tremendous waiting list at the moment, and that's just going to kick that back. Counter argument, of course, is, well, if we don't reopen now, when are we going to? They don't want to reopen in winter. They don't want to reopen when the schools are going back in autumn. They want to have the summer on our side so people can be outside and reduce spread because of the summer weather. And they didn't mention it, but in the sunshine people make more vitamin D. So there is arguments on both sides. Best projections, this increased wave at the moment, peak is going to be between August and mid-September. So it looks like late August, early September is going to be the worst time. So things are going to get better, going to get worse in about 3 weeks' time, dramatically, because it takes 3 weeks to know the effect of easing, of course, because we always have this delay. So I think we can say that by the end of August, beginning of September, cases are going to be astronomical. They're going to be very high. There's no two ways about that. Many people are going to carry on with correct protective behaviour as we need to. The more people that carry on with this correct protective behaviour, the lower hospital admissions are going to be. The more people go back to a pre-pandemic lifestyle, the greater hospital admissions are going to be. It really is very simple. And that's even with ongoing vaccinations. Now, the government are going to introduce a COVID passport from the end of September. So Prime Minister just announced today that from the end of September, people are going to need evidence of 2 vaccinations before they're admitted to crowded venues, like presumably, it's not spelled out yet, but presumably nightclubs, maybe some pubs, maybe some restaurants, we don't know yet, theatres, cinemas. That's going to be necessary. Evidence of a negative test will not be sufficient. Evidence of 2 vaccines will be required to get into many of these venues. No 2 vaccines, don't get into the venue. And that looks like it's going to be a legal stipulation. So that will happen from the end of September. But of course, the irony is that we've got between now, the 19th of July, and the end of September. So we've got all of July, all of August, all of September for these massive super spreading events to take place. And they will. They will. So this is, some might say, a little bit late. Long COVID. Possibly another 500,000 people could get long COVID. Hopefully more on long COVID soon. I'm in touch with the founders of the UK and the Netherlands long COVID societies. So hoping to bring you more on that soon. Another 500,000 people get long COVID as a result of this outbreak. Neil Ferguson again, I think case numbers are likely to be declining at least by late September, even in the worst case scenario. So case numbers are going to be going down by late September. Okay, so the peak's going to be early September to mid-September. Late September, peak is going to be going down. Going into the winter, I think we will have quite a high degree of immunity against COVID. In other words, whether this is intended or unintended, whether it's over, covert, whatever it is, we are now in a herd immunity strategy, in England at least, and pretty well in Scotland. And Wales and Northern Ireland are sort of heading in that direction, or be a bit later. So whether that's declared or not, that is what we are currently doing at the moment. The real concerns are a resurgence of influenza. This is Neil Ferguson again, because we haven't had any influenza in the past 18 months. So resistance is down. We've had essentially no influenza last winter. There could be an outbreak of influenza A. In some years that can be really bad. Let's hope this isn't a bad one, but it's a risk. Flu could be, frankly, almost as damaging, both for the health of the health system, but both for health and the health of the health system by December or January, as COVID has been this year. So now I don't know why he's saying that. I don't know any evidence for that, actually. I don't know that we've got influenza variants in the world that are particularly transmissible at the moment. Really a bit early to know that yet. Normally what we do in the UK is look at the Australia situation, and if things are bad in Australia, then they're probably going to go bad here as well. But I don't think we've got information on that yet. So it looks like Neil Ferguson's being a bit pessimistic there, or looking at a worst case scenario. But of course, worst case scenarios, unfortunately, as we've seen, can come to fruition, unfortunately. Jeremy Hunt, former Health Secretary, the government was likely to have to reintroduce some controls in the autumn. So Jeremy Hunt, pessimistic. Hospital admissions, NHS was facing a very serious, direct quote, a very serious situation. So Jeremy Hunt predicting autumn, there might need to be some reintroductions. Professor Van Tam, Deputy Chief Medical Officer, bumpy winter, these are precise words, bumpy winter ahead. Approach the easing in a cautious, steady and gradual way, of course, is what he is recommending. But he thinks it might be a bumpy winter. Now, the other thing in the UK is lots of people are being pinged on the NHS app. And so people are talking about a pingdemic because so many people are off self-isolating. I mean, the Health Secretary, Sajid Javid, tested positive. Apparently he pinged Boris Johnson, the Prime Minister, and Rishi Sunak's been pinged as well. So like the most senior 3 ministers in the country are all pinged in self-isolation. And a lot of other people are as well. The pinging and the expectation to isolate for 12 days is rising exponentially. As of the 7th of July, so that's well over, 10, 11, 12 days ago now, nearly 2 weeks ago, but 500,000 alerts are sent to NHS. So even 2 weeks ago when this data is available, 500,000 people were expected to self-isolate. Now it's going to be much higher than that. So it's probably getting on for 750,000 to 1 million people who need to self-isolating now because they've been pinged on the app. So that week on the 7th, end of the 7th of July was 46% up. So if it's another 46% up, work it out. And the pinging level is about 3 to 1 of COVID cases. So if we get 50,000 COVID cases a day tomorrow, which is probably about what we will get tomorrow, maybe even higher, then that means 150,000 people have to self-isolate. It's like 1 million people a week. You know, basically we can't have this many people out of the workforce without major disruption. But this is the situation we are in. So really, we need a situation where people have reduced self-isolating requirements if they're doubly vaccinated and can be released from self-isolation if they are tested negative is perhaps the way ahead. But at the moment, it's a problem. From the 16th of August, but that's like another month away, isn't it? Fully vaccinated people will not have to self-isolate if they're pinged, but that's not yet, so we've got another month to get through yet. Instead, advised to take a PCR test as soon as possible, which makes sense. But at the moment, it's if you're contacted by test and trace after being pinged, it's a legal requirement and you can be fined for not self-isolating. So transport's down, supermarkets are down, NHS is struggling, car factories are struggling all over. There's so many people are self-isolating. This has become a real economic issue. One of the supermarket bosses, the clock is ticking and the government needs to act fast to get people back to work if they have a negative test. If not, we could be heading towards crisis point next month. Now, pretty strong words for supermarket managers. Pretty strong words. Morrison's supermarket, one of the UK supermarkets, throughout the whole of the pandemic, we've not been required to close a store. Absolutely brilliant. Let's just remind ourselves of the heroic supermarket workers that these ladies represent. And this is why it's so annoying when I find people being disrespectful to supermarket workers. It's completely unacceptable. British Retail Consortium, government must bring forward the changes of self-isolation the 16th of August. Let's see what happens. So that people are fully vaccinated or have a negative test are not forced to needlessly quarantine in their view, which I suppose is more or less true. Okay, just slightly other news. Joint Committee on Vaccination and Immunisation. They've just announced today that they're not doing 12 to 17-year-olds yet. They're looking at more data. So when that will come, we don't know. Vulnerable 12 to 15-year-olds or people living in vulnerable families can now get vaccinated, as can those within 3 months of their 18th birthday. But for adolescents, 12 to 17s, not yet fully decided what is going to happen there. Hope you got the chance to listen to the reports from Uganda and from Taiwan and South Africa that were posted recently. Do try and check those out. Here's a report from Dr. Nigel Farrier, our correspondent in Perth in Australia. And I think he's going to be talking about his experience and Indonesia today. So let's listen to Nigel now. Thank you, Nigel.
So, hello John. I just thought I'd give you a quick update. I've just watched one of your videos from today or yesterday. I'm recording this on Friday the 16th of July, where you were going on about aspirating before vaccinating, which you've been talking about for a while. So my wife and I yesterday on Thursday went and had our second COVID vaccination. And the first time we went, our GP was the person that gave it to us, and I asked him to aspirate and he said, yeah, no worries, and he did that. So this time I asked the nurse, who was the one assigned to give us our vaccination, if she could aspirate first, and she said, I don't know how. Now this girl's in her 40s, she's been a nurse for a while, and she said she has never been taught how to aspirate before giving any injection, and she was interested to know why, so I explained to her about the papers that have been published regarding this, and I then had to teach her how to do an aspiration before giving the vaccination. So this was quite astounding to me, but she was quite happy to do it and did a very good job. As I said, both my wife and I had our vaccination 27 hours ago. We've had no side effects this time, felt nothing. My wife last time, as you may remember, got quite a bit of a fever and lethargy as a result of her vaccination the first time, which was about 8 or 9 weeks ago. So we're both now fully vaccinated. And we now have to wait the usual 3 or 4 weeks for the AstraZeneca to boost our immune system up to a reasonable level. So I thought that was quite astounding, actually, that nurses, she said, are not taught to aspirate and don't know how to aspirate. I was quite shocked. But anyway, there it is. Now I've just got a little piece to tack on to the end of this regarding Indonesia, which is having quite a hard time. So if we take a look at Indonesia, who are our close neighbours, they've got a population of 275 plus million, and as you can see from this, they're getting steeply rising cases. That's up to almost 60,000 per day. The deaths are rising badly. They're over 1,000 deaths per day now, and they're basically taken over from India as the COVID epicenter of the world, I think. And just to prove it, here's mass graves. They've got a front end digger digging all these graves, and yeah, heart's got to go out to these people, just as it went out to India recently. These poor people are suffering. So hello John, I just thought I'd give you a quick update. I've just watched one of your videos from today or yesterday. I'm recording this on Friday the 16th of July, where you were going on about aspirating before vaccinating, which you've been talking about for a while.
Sorry, I thought Nigel was going to go on to another video there, but it was the same one again. My apologies, Nigel, and to you for messing that up. Right, second vaccine, brilliant. No side effects so far, which is excellent. Now, can you believe that? Have you just found a particularly challenged Australian nurse, or is it that all nurses in Australia aren't taught to aspirate before intramuscular injections? Now, if this is the case, then someone from the Australian Nursing Council or whoever's in charge there needs to get this by the throat pretty soon, because some intramuscular injections, especially if they're oily in nature, if you give them via inadvertent intravenous administration, that is a life-threatening situation. So don't know what's going on there. If someone's in charge of nurses in Australia, do let me know. I know I taught all my students, every year I've taught students how to do this, how to aspirate. So don't know what's going on there, Nigel, but it is quite astounding. And yeah, don't know quite what to say really. Right, okay. Of course, we've had that letter from our vaccines minister, Nadeem Sahari, saying that we don't need to aspirate in the UK for these vaccines. I don't know what else we can do, really. Anyway, that's that one. But not knowing how to aspirate at all is just inexplicable. Indonesia, things are bad, but of course that's on the back of a very low level of testing, so things are probably even worse than they look on that graph. So that is us for today. Let's carry on watching the UK experiment with interest and indeed a degree of, well, quite a degree of trepidation. Thank you for watching.